winter safety, an important and timely topic for our winter weather. It's something that we're going to be discussing on our show today, and I'm joined by a fantastic group of folks who are going to give us some safety tips, including Rachel Oldenburg, who is a physical therapist here at Mile Bluff Medical Center, Nick Hewitt, pharmacist at Mile Bluff, and Mary Crowley, registered nurse and emergency management director at Mile Bluff Medical Center. We'll learn some tips for staying safe when shoveling, walking on the ice, and when it's extra cold. We're here at Mile Bluff Medical Center. I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're at Mile Bluff Medical Center today talking about shoveling safety. Why are we talking about that today? Take a look outside. There's plenty of snow and ice to be removed from your sidewalk or driveway. And so I've got a great panel of folks. Welcome. Good to have you with us here today that are going to talk to us a little bit about why it's so important to be safe when dealing with some of those things that are so native to Wisconsin. So I'm going to start with Rachel Oldenburg. You're new to the show. Welcome.
I am. Thank you.
Why is knowing and practicing proper shoveling technique so important?
It's important because shoveling is a very physical activity. It puts a lot of stress on your low back, especially if done improperly. It can put a lot of stress on your spine or those discs between your vertebrae. It also can put a lot of stress on your heart, especially if you're somebody who's not used to doing that much physical activity, or if this is more than what you do on a normal day-to-day basis. As well as there's always that risk of falling because you're walking on that slippery surface. It's important to wear the proper footwear so that you avoid falling, avoid those bumps and bruises, possible fracture bones, hitting your head, concussions. So it's always important to take those precautions beforehand.
It's always amazing how quickly we forget how to walk on the ice. Even though many of us have seen many winters, we often forget how to walk on the ice. You got to do the Wisconsin waddle. So I'm also going to ask you, Rachel, is there a snow shovel that's better suited for some people, or just a snow shovel that's far superior in general? How do we go about picking a snow shovel that works?
Absolutely. Everybody is built a little bit differently.
Okay.
It's important to pick a shovel that's the right size for you.
Sure.
What we usually recommend is the shovels with the curved handles. That way you can place your hands a little bit further apart and you have a little bit more leverage, so it takes some stress off your low back. We also recommend plastic or lightweight shovels with smaller scoops so that you're not lifting as much snow.
Sure.
It might take you a little bit longer to get the snow shoveling done, but it's taking that stress off of your back.
Yeah, very important to not have that strain on your lower back.
Absolutely.
I would imagine. So that's probably the biggest thing, I would think, the injuries that you see as far as, if it's not a falling related thing, it's just the strain on the lower back.
It is. We see a lot more people in the clinic during this time of year.
Yeah. Mary Crowley, you are the Mile Bluff Emergency Management Director. Good to have you back with us.
Thank you.
And you're responsible for helping to ensure that the organization is prepared for emergency situations. Do you have any tips, though, for the general public to keep in mind when preparing their homes and their families for the sometimes unpredictable Wisconsin weather?
Okay. That old saying, an ounce of prevention is worth a pound of cure, absolutely applies in this situation and many others. Wisconsin winters though they're Wisconsin winters, we're going to have them. They're going to show up and they're going to put some strain on us, but that's why we're here. We just like that.
Yeah, we must, otherwise we wouldn't stick around.
There we go.
So, and then Nick, I'm going to jump over to you. Nick Hewitt is our resident pharmacist here on the panel today. It's interesting because one doesn't often think of medication when thinking of safety when it comes to winter weather and so forth, but why is focusing on medication safety so important to this topic?
Well, obviously you take meds because they do something good for you. They make you feel better, they treat a condition, but they're going to have side effects.
Right.
And in the winter, when driving is harder, walking is harder, you have to deal with snow shoveling and other fall and injury risks, any side effect from meds is going to be exacerbated. It's going to be made worse, especially if you're taking cold meds and buying things over the counter that maybe you don't usually take, and you're not sure how they'll affect you. So it's the usual precautions. If you know a med's gonna make you dizzy or drowsy, then if you're gonna go out driving in the snow or shoveling the ice and snow, you might want to take that med afterwards, or it's simple precautions like that. But a lot of times medication can be a big risk that will add to ending up in physical therapy for your injury or in the ER because of a strain or a problem.
So. Sure. So if you're taking prescription medication, important to talk to your doctor. Over-the-counter medication, talk to your pharmacist. Make sure you know what those side effects are so that they're not exacerbated when you're straining yourself to lift a big heavy pile of snow, which hopefully you're not doing. So when we come back, we got to take a short break. When we come back, we're going to talk a little bit. We're going to learn some safety tips from the experts here at Mile Bluff Medical Center. Stick with us. Staying safe during the winter months, especially when it comes to snow and ice removal, is such an important topic, and that's what we're talking about here in Wisconsin Doctors at Mile Bluff Medical Center. And Nick Hewitt, I'm going to ask you, as we get older, I mean, obviously you're our pharmacist, so as our medication lists seem to get longer and longer, do you have any tips for helping people to remember their medication doses?
The key thing there is medication list. Sure. Having a list helps. Now, it helps the pharmacist and the doctor when you visit them, especially if you're taking things that are over the counter that they wouldn't know were prescribed. It's also good in the winter when there's going to be emergencies. You may be stranded. You might have a chest pain or a back problem where you have to go to the doctor or the urgent care or even the emergency room, and it's good to have that list with you.
Sure.
Or available for a family member in case you've fallen or hurt yourself. So there's lots of med lists. Usually you can write things down, including allergies, doctor, pharmacy number, just any information you need in an emergency. There's little ones that fold into your pocket.
Oh, you can just
your
keep that
wallet.
in your wallet. That's pretty easy.
And there's other ones. This is from the retail pharmacy in town. They're kind of like the index cards, a little bit bigger.
Right.
If that's preferred, write it down in a notepad.
Yeah.
It's absolutely fine. Or I love when people come and they have a little app on their phone, a Walgreens app or something like that, and they've got their med list on their phone. As long as it's not password protected, that's good also.
Right.
So lots of options for keeping a med list that's up to date and always handy.
So the people who are kind of the first responders for emergencies need to know what medications you're taking, and this is an important reason why you need to have a list of medications on your person at all times.
Absolutely. Now, as a pharmacist, it's always easier to take those pills if you know what you're taking, why you're taking them. It's a little easier to swallow that bitter pill.
Absolutely. And Mary Crawley, I apologize, by the way, I kind of walked over you in the last segment there. I don't think you finished your answer. We were talking about what people can do to prepare their homes and their families for the inclement weather and the unpredictable weather here in Wisconsin. But I also want to ask if you have any suggestions on what to include in an emergency kit that would be used in the unfortunate event that you might find yourself stranded in your vehicle.
Oh, very good. In general, you need to make sure that you've got enough food and supplies that you need to have when you get isolated. If you get isolated in, people can't necessarily get to you either. So you need to be prepared to be a little self-sufficient for a while. So your foodstuffs, your fuel that you need for your home. If you've got small children, make sure you've got enough diapers in. If you are on your medications, make sure you've got enough of them stocked in your home. Make sure you check your fuel supply, those kind of things. If you're going to be out and about and having an emergency kit, when you've got small children, you always carry that diaper bag with you. Well, as you get older, you can update that and call it a Go Kit.
A Go Kit, I like that.
Okay, and a Go Kit can be applied to whatever it is that you're going to be needing to have. Snacks in there.
Sure.
Some people carry water or some kind of perishables. This is the kind of thing you take in and out of the vehicle because you really don't want that to freeze up and cause kind of trouble.
Sure, yeah.
Then there's the standard emergency car kit. You got your flashers, you know, your
The road flares?
Yeah, thank you. The road flares.
Right.
The road flares are that little sign that you hang outside your window if you get stuck outside the snow.
Right.
Make sure you've got your mittens. Make sure you've got blanket or two in there. You've got to have an ice scraper. This is Wisconsin. You have an ice scraper.
Got to have an ice scraper.
You have to have a shovel, small shovel. Need a small shovel in your vehicle. The kitty litter or the sand.
Sure, yeah.
Yep,
that kind of
absolutely.
thing, to get out of whatever it is you get stuck into, that kind of thing. And carry a pair of boots in there, even if you don't usually wear boots, because if you're stranded or stuck somewhere, you might have to leave the vehicle for a short period.
Yeah, high heels wouldn't be too good of an idea.
No. We have opinions about that too.
Right.
But so that, or spare socks, that kind of thing, because if your feet get wet, the rest of you is going to be cold too.
Yeah, absolutely. Yeah. Rachel, and thank you for those tips. Rachel, what tips would you have for using proper upper body mechanics when shoveling snow?
Absolutely. When you're holding onto that shovel, you're going to want to place your hands about 12 inches or a foot apart. So that gives you a little bit more leverage. You want to make sure you're using good mechanics with your back as well, keeping your back straight or only bent forward up to about 10 degrees. Keeping the knees apart, always bending at the knees and lifting with the legs. At any time, keep that shovel in contact with the ground. We want you to push the snow away. We don't want you to pick it up,
Lift it,
throw it over
Yeah.
your shoulder. That causes a lot of bending and twisting. Now, this is Wisconsin. We're gonna have, a couple feet of snow at some point that we're gonna have to
Right.
remove. Take it layer by layer. Just lift a little bit, move your feet, take it to where you wanna dump the snow, and then dump it. Rather than twisting and turning and bending, that puts a lot of stress on your back.
Yeah, absolutely. And when we come back from our break, we're gonna learn a few more tips, and then we're also going to learn when it is necessary to seek medical attention in the case of emergencies. So we'll be right back with more Wisconsin Doctors. Stay with us. We've been talking safety tips here at Bluff Medical Center and Wisconsin Doctors for safety tips for staying safe in the winter months. And Mary Crowley, I want to ask if you can share, we kind of touched on this in the last segment, but I'm wondering if you can share with us some specific things that we can do to stay as safe as possible out in the cold.
Out in the cold. Okay. It's important to prepare for your environment. So dress in layers.
Right.
Mittens over gloves
Okay.
to keep your fingers a little bit warmer.
Sure.
Be aware of the outside air temperature. If you've got a condition that's going to be impacted by cold exposure, be prepared for that.
Right.
If you have to be outside for a long time in extreme cold, break those tasks into doables.
Sure.
So if you need to get all these things done, get done what you need to get done, go into find some shelter, go back and finish out what you need to do.
Right.
A lot of Wisconsin activities are outdoors and they're extended.
Yeah.
A lot of Wisconsin jobs are outdoors and they're extended.
Yeah.
So breaking those things into doable pieces is a good idea.
Yeah.
Be aware of how you're doing and how the people around you are doing.
Yeah.
The worse you feel, the less inclined you're going to be aware of it, because cold is a numbing kind of thing.
Yeah.
So watch out for your partners, watch out for the people that are with you.
Yeah, absolutely. And it's interesting because, I think as Wisconsinites, we have this sort of get it done mentality, and so we wanted to stay outside, and however long it takes us to get it done, we're going to stay outside until the job's done. But it's really not worth it.
It's too much hassle to get undressed and redressed again.
Right.
So yeah, we're going to get it all done at once. But absolutely,
Right.
we have to be prepared, we have to be safe.
Yeah, it's worth it to stay safe. Rachel, let's talk a little bit about shoveling again. Shoveling heavy snow, because obviously, it snows still when it's right around the freezing mark, and that snow tends to be a little bit more heavy, can lead to some pretty sore muscles. How do you know when it's more than just sore muscles and when it's important to actually seek medical attention, that this is an injury?
That can be a very difficult question to answer. And to be honest, everybody's going to be a little bit different. But usually muscle soreness from lifting and carrying snow is going to set on that same night and the next couple days, lasting up to a week.
Okay.
Things that are of major concerns are, especially if you fall, if you hear a pop, a strain, if you have sudden intense pain that doesn't go away, it's time to seek medical assistance. So keep in mind that the ER is open 24 hours a day. If it's something that can wait, urgent care is open on weekends, they have extended hours. And a lot of times you can call and get in to see your physician on the same day too, if you think it's more something
Right.
that you need to see a doctor for.
So the sudden acute pain that just doesn't go away.
Absolutely.
Yeah, more than just the soreness for sure. I want to talk a little bit about the roads, because obviously, depending on where we are, traveling on the roads during inclement weather can be a concern. So, what health concerns, and this is for you, Mary, what health concerns should people watch out for in terms of exposure to Wisconsin's cold?
Again, be prepared and take cover. The first thing I'm going to recommend for traveling issues is make sure that you've got enough fuel in your tank.
Right.
At least a half a tank even for short trips, because you never know how long something's going to be delayed. You're going to be out there longer.
You got to keep that engine running.
You've got to keep the engine running. You've got to be able to do that kind of thing. Have your emergency kit available to you. Stay undercover. Again, leaving your vehicle is not always a good idea. In fact, it's rarely a good idea. You may need to leave it short periods of time. You should make sure that if you're stuck in deep snow, that you keep your exhaust area clear in the back so you don't build up with carbon monoxide in your vehicle.
Yeah, that's good advice.
Just saying.
Right.
keep that part open. Keep your flashers going. If you got that little red emergency flag, hang that out there. Sometimes people make markers in the snow if they've been pushed off the highway for a bit.
Oh, sure, yeah.
I've had people come in my emergency department days who they marked their location because they had left the highway for quite a while. They built a little snowman out there and put their extra mittens on top of the snowman so that somebody go, well, that's the oddest thing. And then they look and they go, oh, there's a vehicle out there. So anything that you can do to kind of help yourself kind of get flagged in.
Yeah.
But stay in the vehicle.
Right.
Be smart about using your fuel. Be smart about using your battery power.
Yeah.
Do stay visible. Do be as visible as possible, and think about safety kinds of stuff. And that's where that little go bag is going to come in handy, so you can keep yourself hydrated and nutrition.
The go bag. I love it. I love it. Diapers not necessary, of course.
Not for everybody, I hope.
Right. Excuse me, Nick, do you have any general advice for viewers who are using their medications wisely, making sure that people are using medications wisely during this time?
Sure. My obvious answer is ask your pharmacist. We're always available. Most medication bottles, they have the instructions on there, and they'll have little side labels. They'll say, don't take with alcohol, don't have heavy machinery, take with water, whatever it may say. There's a reason that's on there, because that will make the med either work better or be safer for you.
Right.
Getting back to the asking a pharmacist thing, people see their pharmacist far more than they see their physician.
Sure, yeah.
It's just the way it is. You're there at least once a month. Probably not seeing your doctor that often.
Right.
So it offers that opportunity to pick our brain.
Yeah, absolutely. Pick your pharmacist's brain. It's important. They know a lot. We got to take a short break, and we're going to come back with some final safety tips and preparedness tips right after the break here on Wisconsin Doctors. Staying safe during the winter months, an appropriate topic here at Wisconsin Doctors at Mile Bluff. One thing, though, we haven't talked about is hypothermia and frostbite. So, Mary, I'm wondering if you could shed some light on that. I mean, we talked a little bit about when it's appropriate to seek medical attention. Can you talk to us a little bit about recognizing the symptoms of hypothermia or frostbite?
Absolutely. Frostbite is going to be the more common thing that you're dealing with. Frostbite is going to happen when it happens in the fingers and the toes and the tips of your nose. I'm sure there's a poem in there somewhere. But basically it's about circulation in small, tiny areas, and there are chemical changes that happen because of the cold, and it impacts your tissues.
Okay.
And it's painful, and it can progress like any kind of a burn or any other kind of a tissue injury can progress over time. So you need to watch out for that early. That's the advantage of the mittens and the warm socks. It starts with the cold and the pain. It starts out red, turns white. When you pinch it, you have a natural blanching reflex. Because the circulation is compromised, you don't have that anymore. Just whatever you pinch stays white.
Okay.
And it's very, very painful. That has to be addressed. And once you've suffered frostbite in an area, you're more inclined to have repeat episodes of it because of the compromise until your tissues totally heal.
Right.
So watch out for that. The thing that people think it's cold, so I want to warm it up, so they apply friction. Don't do that because that's going to cause more damage to the tissues inside.
Okay. Wow.
So we're going to, there's a gentle rewarming, and it's with, you know, the cooler water, and then you work your way up to that kind of thing, and gentle flexing, that kind of thing.
Okay.
And move forward with that. And that doesn't have, you can't fix that all at once. That takes, as long as it took to get cold, it's going to take to get warm again.
Okay.
Don't rush it.
Don't rush it, okay.
Don't rush it. And if you have any problems at all, any blisters or continued pain, you need to seek medical attention earlier than later.
Sure.
Because we have to deal with tissue protection, and fingers and toes are very important things.
Yeah, absolutely. And then hypothermia.
Hypothermia can happen more than people think about being exposed to, you know, the minus 20 wind chill kind of thing, and the hypothermia. Hypothermia can actually happen at temperatures of, you know, 20 and 30 degrees.
Sure, yeah.
It's about the exposure and about the duration of the exposure and your activity during the exposure. So the cooler it is and the less you're busy, the more your core temperature is going to cool down. And you'll notice the early symptoms will be like shivering and chilling, and then it goes into like a sleep part. They get drowsy, they get tired, they get confused, they just don't feel good, and the person themselves probably is not going to notice it because they're not feeling well, they're not thinking well.
Yeah.
So it's going to be up to their buddy or the person next to them to kind of go, you know, you're just not feeling very good. Let's get you in someplace warm.
Yeah.
And again, we're talking about gentle rewarming.
Right.
And you're going to rewarm from the core, which is going to be like warmed fluids, but not a whole lot at once, just sips in time.
Sure.
Get all that cold, wet stuff off,
Yeah.
because that's just going to help. It's going to cause more heat loss. It's going to help with the heat gain. And even if your outer layers are dry, the inner layers might be wet because of sweating or perspiration. So you need to get all that stuff off, and then gentle rewarming from the inside out.
Good advice. Good to be paying attention to things like that. I want to talk real quickly before we go about falls. Nick, is it true that certain medications can increase your risk of falls?
Absolutely. I mean, a sleep aid is going to make you sleepy. And there's lots of other pills that have side effects for drowsiness, dizziness. The ones that can dehydrate you, especially any kind of diuretic or water pill, will lead to that sort of thing. Again, if you want to make sure you're reading your labels and you're familiar with your meds. If you have questions about that, a lot of times a pharmacy consult is good. They're also called MTM, or medication therapy management. That's knowing all of your meds and what side effects to experience. We do that free here at Mile Bluff at our health fairs. Next one is February 9th. Those are by appointment. Most retail pharmacies, Walgreens, Hy-Vee, CVS, they'll do them and just bill your insurance for it, so then you can kind of schedule it at your leisure. So there's two different options there for sitting and talking with your pharmacist.
And Rachel, our resident shoveling expert here, any tips that you can give in general for people to stay safe and not fall on the ice this winter?
Absolutely. Use that Wisconsin waddle that we talked about. You want to keep your feet flat to the ground, take short, small steps, increase that contact time with the ground, and as soon as you get inside, take your wet shoes off, because the bottoms are going to get slick. If you take a couple steps inside, your risk of falling is still great inside.
Wow, that's good to know. Risk of falling, still great inside. I want to thank all of my guests here today, Rachel Oldenburg, Nick Hewitt, and Mary Crowley. Thank you so much for the tips. And thank you for watching. And stay safe this winter, stay warm, and from all of us here at Wisconsin Doctors, we invite you to live longer, live better. We'll see you next time.